in Scottsdale.
Pelvic pain and pressure affect hundreds of women, but the latest advances in feminine health are making it easier than ever to live your best life. Here with details is Dr. Burt Webb with Scottsdale Center for Women's Health. Great to see you, Dr. Webb.
Thank you.
So, Dr. Webb, tell me a little bit about what's causing all of this pelvic pain and endometriosis, and what are some of the options for people with these problems?
I think that we're finding that there are many problems that are causing pelvic pain. Endometriosis, ovarian cysts, was often thought to be really the only thing that caused pelvic pain. Now we're finding that there can be everything from diet. So for young women with bad periods and pelvic pain, we can help them with diet. But it's easier to be a little more aggressive with special kinds of ultrasounds that we do. There's laparoscopy is much better. The equipment's smaller than a pencil, so you can look for someone that has repeated problems, who's not getting better with birth control pills or whatever they're doing. And that goes as the women get older. There's lots of other options as they develop pain and different possibilities. Fibroids can cause pain. You can get venous congestion. And those are relatively easy to diagnose as well as treat. They don't always have to have surgery.
Now, you mentioned food issues that may be playing a factor in that, and also environmental issues. Tell me a little bit more about that.
We're big believers. I've had some special training in something called functional medicine. I'm not a functional medicine specialist, but it's a new way of looking at medical problems, so that ordinarily if you came to me with a headache, I might give you a prescription for a headache medicine. Now, if you look at the person's diet and their stresses and certain food sensitivities, we can often help them have fewer problems by just taking that simple approach.
And how do people know if their pelvic pain is actually something more serious?
Well, there's many diagnostic tools that we use that we do in my office that are specialized and aren't done very many places. So really very simple testing, we can diagnose a lot of different kinds of causes of pelvic pain.
And I didn't realize that after cancer treatment, women often have a lot of problems. Tell me about some of the adverse symptoms that they might be having.
So very often after a woman is treated for cancer, she's not allowed to take hormones. The most frequent example is breast cancer. And then the doctors don't want them to take estrogens, which is fine. But then their tissues get more painful, so relations get more difficult. And they have a partner that they love and is taking care of them, and they want to continue having relations, and they can't, or it's painful, and so they suffer a lot. And so we've come up with some really neat ways that, without using estrogens, that can help them maintain the vaginal health and continue normal relations.
And tell me a little more about all the different treatment options that are available for people with pelvic pain.
So we use everything from laser treatments. There are some special hormones that we will also use. I'll use physical therapy to help, and we use different laser treatments, and then we're also using a PRP. So you might hear of athletes getting it in their knees, or actually everyday people getting it in their knees and shoulders, and it's helping those joints heal and be healthier. We're using the same thing in the vagina and that area, and really helping everything from lichen sclerosis, drying of the vagina, to leaky bladders. It's really been really helpful at avoiding surgeries and giving women other options.
And you've got a special offer for our viewers right now too,
yes.
kind of for the holidays coming up. You've got a Cyber Monday special.
Yes. So if they get tired of shopping, they can call us and find out about all of our specials that we have, both cosmetics, but also we will be offering some specials on some of the things that I've talked about.
All right, take care of yourself first.
Yes.
Thank you, Dr. Webb.
Thank you.
And if you'd like more information on Scottsdale Center for Women's Health, visit them online at scottsdalewomenshealth.com or call the number on your screen.